Swayam Prabha. Digital India. Educated India.
Welcome viewers, welcome back to this course on ESD, that is Education for Sustainable Development, and we were discussing about the ESD and sustainable healthcare. So, we have already discussed a little bit about the dimensions and what are the key issues of sustainable healthcare system, and how the patient care is very important, and how waste management should be taken into care. Then how that means how it can maintain a balance in our ecosystem in our health and health domain, as well as the financial or economic cost effectiveness. All we have already little bit discussed. Now, to continue with that, now we will discuss about the other things, like for example, again for all these kind of things that we have discussed till now, like starting from the strategic thinking to critical evaluation to planning to economic aspects to feasibility to cost effectiveness, then waste management, everything. Again for this so many things are internal factors, so many things are external factors, but at the same time there should be the public support should be there, and it should be political and public support, and the political support also support and acceptability should be there, because with the public support and the political support the system can be more robust, the system can perform well, the system can function well. So, for sustainable healthcare system, it is not just about the investors, it is not just about the stakeholders, it is not just about the proprietor who has entrepreneur who has started this venture, but again all stakeholders, be it public, government, private services, private enterprises, then local public, then all kinds of supports are very much necessary, very much essential, because it is it is a very it is a humanitarian service. So, for this matter everybody's contribution, everybody's support, and more at least moral support should be very important, and it should be provided, then only the system can function very well. So, the system's contribution to the economy like through supporting the healthy workforce, yes, those who are in the patient care system, those who are the manpower working behind the system. So, to create a very healthy workforce, we must have to invest money on that, not only in their salary and the privileges, but in terms of their training and continuing education. And we must also create the platform for health research domain, that is the latest research and development should go on simultaneously. So, and again cross sectoral partnership of private and public organizations is very crucial, like PPP model, and we can also install the PPP model, public private partnership, that is PPP model can also be applicable to build a healthy and health creating communities, towns and cities, because it is not just for the community, it is just for the whole society, it is whole for whole system, it is also for the even to the hospitals, all the good hospitals, the people from the rural areas also coming to the reputed good hospitals. So, not just only in terms of infrastructure, but in terms of service and care. So, therefore, we have to take into account all kinds of things. So, here we can see the example experience map of the health corporations, how public private partnership, all the stakeholders, they mutually cooperate, agree and cooperate and collaborate. Similarly, here also research is one of the important component. Then again the whole network of the hospital services, including your infrastructure, action learning, your all kinds of services, everything. So, it is a whole it is a system, it is a miniature society, it is a system that is more concerned about the healthcare well-being and the facilities that is being provided to the stakeholders. So, therefore, it must be supported by the public, the government, both the internal support and external support should be there, and PPP model can also be applied, and again it should be enhanced with continuous learning, research, development. These are some of the accelerator themes, that is under the global action plan of WHO. So, these are some of the primary themes or the core themes for accelerating the health services. First thing is that primary healthcare service, what are the facilities, minimum facilities available in the primary healthcare system. Then again sustainable financing for the health. Again, what is the continuous flow of the finance, the money of the economy into the health sector. That is the continuous flow of money, that is sustainable financing for the health domain. Then next comes important is the community and civil society engagement, as we have already discussed, that is the support, public support, private support, government support, even the MNC support also is very important. Then community support, civil society's engagement, their support, then it is very important, then only the health service can be effective. Then determinants of the health, what are the main determinants of the health, starting from the food, nutrition to communicable diseases, to the infrastructure, to the even the efficiency, efficient doctors, skilled doctors, competencies and the competencies of the support system, all the determinants of health domain. So, this is important. Fifth is that innovating programs in fragile and vulnerable settings for the disease outbreak responses. Like for example, during pandemic, for example, in pandemic and or other kind of like disease, communicable disease, or the outbreak of some kind of diseases like tuberculosis or plague or whatever kind of. So, what is the urgent, emergent, or what is the emergency services, medical services, health services in terms of the mobile services, in terms of extra rural unit services, what is the disaster emerging issues, emerging service units ready for this any kind of outbreak of any kind of diseases, outbreak of any pandemic or any kind of diseases. So, innovating the programs. So, we should be ready, the healthcare system should be ready with this kind of programs and assets or units to reach out to the people, reach out to the people who are in the vulnerable setting, who cannot directly come to the hospitals, and that means to reach to the rural setup and serve the people who are the most vulnerable, most vulnerable people residing in the remote areas and the rural setup. So, again the research and development also is very important, innovation and access to technology, these are very important. And now the data analytics and the digital health services. Now, to make our system, that means to get the feedback, overall feedback about the efficiency and effectiveness, we have to have the data to analyze that. So, data analytics, the health data analysis, data availability and analytics is very important to monitor, to evaluate, to get the feedback of the system, of the current system, so that we can find out the gap areas and we can recover. And the digital health service, with the digital health service, the whole that means time can be minimized, services can be made very prompt and quick services, and the patient before coming to the hospital can have readily available all the data, all his health information with him, so that he can come to the hospital with the minimum time spent. I can get the service and get the service and go back to the thing. Then thereafter the follow up program. So, starting from the OPDs, OPDs to the operation theatres, to the post operation care, to the ICUs, all kinds of service and units should be ready, should be modern, should be up to date with all kinds of facilities. So, these are the 7 parameters, we can say the 7 parameters of for a healthy lives and well-being according to the WHO, World Health Organization's global action plan. So, as of all of us we know, the health means it primarily consists of the 3 domains, from the physical health, mental health and the social health. Physical health primarily it concerns with the we know the body, that the body constitution genetically determine human capacity, physical fitness, then morphofunctional adaptation, then environmental conditions, the biological state of the patient, of the client. This is all related to the biological and the genetic structure of the patient, of the candidate. Then mental health, yes, mental health is the state of well-being. It again of course it depends on it depends on the mental state of the individual, of the patient, in the sense that what is his level of not only the physical fitness or weakness, but again his mental strength to, or his willpower to be resilient, to face this kind of situation. So, mental health mental state of well-being, so it can be boosted through proper counseling, through proper support system, proper from counseling, proper discussion, proper moral support being being given by the doctors, the supporting staff, nurses, etc. So, so that they can quickly or easily cope up with this kind of stresses and normal stresses in the life, in life, day to day life. So, and they can also work productively, in the sense that productively to make this contribution towards others also. So, after getting the services, each individual candidate client can also support other patients, other public, other people who are coming to the hospital. So, that means kind of disseminating the information, spreading the information, that now more with the patient who is the old patient can also give the moral support to other people who are coming up, or to the known person who are keen to go for any medical treatment. So, usually in medical treatment and health service, definitely all of us we used to consult. We used to consult with not only with our caretakers and near and dear ones or the family members, but we also consult with different doctors. We also collect the information about the different hospitals, health services from other public or the other sources, other information sources. We used to, before going to the hospital, definitely all of us, we usually have a rough idea, an impression about which hospital is good in terms of service, in terms of medicine, in terms of counseling, in terms of caregiving. So, that is the mental health, how to enhance the mental health, willpower or mental state, or being positivity, or that kind of positivity and willpower to face this kind of stress in the life, as if it is very normal, as it is very normal and it is very quick. So, doctors' voices, doctors' counseling and the nurses' care. Doctors' counseling and nurses' care are the most important thing in patient care service in enhancing the mental health. And the social health, then again social health is defined as its ability to interact and form the meaningful relationship with others, not only with the doctors, but also the supporting staff, with caregivers, the even medical staff and other technical staff, how to build up a rapport, a good relationship, meaningful relationship. So, that primarily depends on human love, care, empathy, etc. So, that the patient becomes more resilient, patient becomes very resilient in facing all kinds of things. So, that to build social health means there is all kind of interpersonal relationship, meaningful relationship that usually built up during the process of health treatment. So, that helps in enhancing the adaptability and the social environment in which the care is being provided. So, that create a kind of healthcare ecosystem, very conducive, very positive and very conducive to deal with. So, then so what is social health? To elaborate on this, what is social health? That is, yes, definitely we know that is to create a very good relationship, how properly we can relate well with others, how we can adapt ourselves to any kind of social situation. Then again social health is also very much related to comfortably associate with the people and communicates freely before the doctors, before the nurses, before the other medical support staff, having the good physical and mental health to deal with these things. And but again at the same time, it is a kind of interpersonal relationship where you are getting the response, so that this kind of good social health services and the interpersonal relationship can also help us in reducing our depression, stress, anxiety, and can move on towards the general health and well-being. So, that means all kinds of human touch, the care, the love, the counseling, all these things putting together that create a kind of very healthy supportive ecosystem. So, from where we get the encouragement, the stimulus, the resources to deal with our to ease out our anxiety, to decrease or to reduce our stress and depression, and gradually move towards the healthy recovery, quick recovery. So, here along with the social health, then comes our sustainable health. So, sustainable health is again, sustainable health is also again it involves a personal commitment of the individual. So, it is not just about the social health, it is not just about the mental health and the physical health, but it again it's individual's commitment towards maintaining and taking responsibility of your own hands, that is this ownership. So, this is the owning the responsibility of your own health, be careful about your own health, adopting the healthy habits, all kinds of, that means maintaining your health is your individual responsibilities. So, that personal commitment should be there. So, the personal commitment to maintaining and taking responsibility for our own health, and through various kinds of proactive means, preventive things, and nowadays with all kinds of traditional therapies like herbal products, herbal ayurvedic things, regular exercise, then mind exercises, then meditation, then prayer, then yoga, these kind of these are the proactive measures. So, all these things through all these kind of proactive practices, etc., we should maintain our health in the sense that we should take the responsibility of our own health, and we should be committed to maintain that kind of thing. So, that is called the sustainable health, etc. So, here there are three ways to balance, the balance of genetics, environment and the state of mind. So, here we can say environment, ecosystem is there, state of mind, our mental health is very important, and the physical health, that is the balanced genetics or the physiological factors. So, here all these things, here again with the physical health, with the social health is relationship, with the mental health, again we have to individually be committed. So, here again another domain is that the personal commitment, owning the responsibility and personal commitment. When all these four things, this physical, social and mental, along with our individual responsibility and commitment, then it becomes sustainable. Okay. So, that we can fully monitor our own health conditions, we can fully take care of our own health in terms of proactive measures, in terms of foods, and in terms of exercises, in terms of medicine, in terms of regular consultation with the doctors, in terms of taking care of our own environment, food habits, all kinds of. So, this is the these personal commitments and responsibilities make it more sustainable. So, therefore, so sustainable health we can define it as, yes, of course, it is a preventive approach, it is a proactive approach. That means, what are the preventions, what are the proaction that we can adopt beforehand, before we fall sick. And in the rural sector, that is that the people are the victims, they fall very often sick and ill because they don't take care of their own health, they don't take care for their own food and nutrition there, etc. So, they are not only that they are less educated, but also they are very careless. So, in that case we have to educate people regarding the common health services, primary health services, food and nutrition, everything. So, that is why ESD is very much required, to educate people, to circulate to disseminate information and circulate the information about all the not only the diseases, but the general health conditions, how to promote, how to be proactive, how to be careful about these things. So, again definitely a balanced state of mind, body and spirit. So, in order to maintain a sustainable health, we have to have this balanced state of mind, peace, healthy body and the positive spirit. So, and taking care of what we put in our bodies, that whatever we take, all our intakes, we should also take into account the amount of water, amount of food, amount of nutrition, amount of clean air, all kinds of things. So, natural medicine of maintaining our health, like for example, some of the mostly used healthy herbal products like turmeric, honey, tulsi and all kinds of Ayurvedic products like the Chyawanprash, then all the food values of onion, food values of garlic, food values of ginger, all kinds of these herbal products can also we take regularly to maintain our health. So, therefore, to lead to lead a balanced life. So, moreover, how to maintain a balanced life, balanced balanced health, balanced life, balanced lifestyle, that is the most important approach towards the sustainable health. And sustainable health has certain principles, that is this principle based on the primarily on the balanced lifestyle, that is maintain a balanced life, that is the most you can say conducive or healthy way or healthy approach or affordable approach strategy, you can say the balanced life. Have a healthy diet, exercise regularly, whatever we have already discussed right now. Sleep is also very important factor, regular rhythm in life, that is routine and discipline. And yes, of course, we should take the preventive and natural medicines for good maintaining the good health. Then engage regular engagement in the spiritual practices, meaningful work, actually meaningful work, meditation, mind training, mindfulness raising the personal consciousness and reflective thoughts, self analysis, even serving others also. We can also make a point that regularly we should not only we take care of ourselves, but also we care for others or helping out others, and service orientation. This can also give us a kind of healthy or positive mindset. So, learn to live and laugh as much as happiness. How can we bring happiness to our life? So, happiness can also cure most of our mental or you can say chronic disease, because some of the diseases are psychosomatic, like primarily created because of the stress and the mental factors, like asthma is a psychosomatic disorder. Similarly, these kind of things can be taken care of proactively through bringing happiness, through bringing joy, and that means all kinds of things, positive engagements and socializing and listening to music, all kinds of things can also make us happy, so that we can also avoid this kind of some chronic diseases. So, building discipline in ourselves. So, discipline is maintaining a regular lifestyle, healthy lifestyle, mind training, raising awareness, maintaining the regular nutrition food, healthy nutrition, and even work life balance. So, and having a very simpler approach to life, like not so much of fond of this luxurious life, comfortable life, or taking this fast food, these kinds of having a very simpler approach to life with a disciplined lifestyle, we can maintain a balanced life, that is not only in our workplace, but our work life balance, but also our own health. So, that is a sustainable lifestyle practices. Here again some of the sustainable lifestyle practices, even though all of us we know, we can educate people regarding this, those who are those who are a little bit disadvantaged, those who are ignorant, who stays in the rural areas or the remote areas, like what is the balanced food, which vegetable, which fruit has the what type of nutritional value, and when to take what type of foods, how the fruits and the things are important, how to that means in which season, again in which season which food to take, etc. So, it's therefore the high protein breakfast, how to maintain the routine, the balanced nutrition, balanced diet, you can say, like having the high protein breakfast, that is in, then physical activities there is very much required, and optimize sleep, that is 7 to 8 hours minimum sleep. Then optimize the vitamin D is from the natural sources, from the sunlight as well as from the supplements. Then reduce the exposure to synthetic chemicals, not to, that means avoid all these kinds of soft drinks, cold drinks, all kinds of chemical products, and again sustainable resolution stick, how even if we are approaching towards the solutions, how sustainable it can be, how, that means always we should focus on more on the future oriented, which will be long term, which the long term positive things. So, therefore, here definitely the nutrition, importance of the nutrition comes first for the balanced lifestyle. So, it is referred as the human's most precious wealth. What type of food? So, when we compare ourselves with our old generation, like our parents and the grandparents, how they were having a very good health, and they long live, etc., because of the food they were taking, because of the quality of the food they were taking. They were taking all kinds of desi ghees and milk and all kinds of that means vegetables and all healthy habits they were having for. So, therefore, their longevity, then their physical health is much more stronger than compared to our right now. So, proper nutritional prevent illness, like the proper nutrition prevents the regular illness and improves the health immunity services, especially our immunity services, and again it optimizes or balance our emotional, cognitive and the physical capabilities. So, with balanced food and the regular exercise and with proper engagement in meaningful work, either it is your job or at home you are doing, so no, you should not be very exhausted, or you should not give very less attention to yourself. So, to maintaining a balance both at home as well as in the workplace, that can optimize our emotional, cognitive and the physical capabilities and the mental health. So, therefore, when within the food also, we must also have a watch on how much nutrition in terms of calories, not only in terms of calories, but also in terms of vitamins and nutritional supplements like the. So, what are the macro and micronutrients that is required, like for example, for this pandemic, like how much we need to take, that means we need to take extra vitamin C, vitamin D and vitamin B complex. So, what are these kind of micronutrients in terms of either from the food or from the medicinal supplements we can take to that means to enhance our immunity system. So, and to fuel the immediate bio energetics, emotional and spiritual needs also. So, we also stick to this both kind of traditional Ayurvedic knowledge, as well as the required preventive medicines available to maintain that kind of to enhance the immunity. So, the national nutritional requirements also of course, it varies according to individuals' daily food intake, then energy, exercises requirements, etc., physical activity, depending on the individual's physical activity and the environment where he stays. It varies from individual to individual, but at the same time we have to be very much vigilant about our own health status, nutritional intakes, and again our work life balance and the our immunity system. So, for that taking self care, taking self care is the major responsibility, and that has to be, so people has to be educated regarding that also. That means your body, your health is your priority, is your responsibility, and how every individual, every citizen, especially in the rural sector, can be very much careful, very much responsible and committed towards his own well-being and healthy life and happiness. That is that we have to educate people from time to time. So, that is also very much important in our society. So, yes, we have already discussed the strong immunity system. Immune system is very important, right kind of food, balanced body, then activity and engagement, and some kind of personal time for the deep contemplation, meditation and spiritual practices, something that is very important to maintain a regular life, healthy life and positive life. So, here again we have to also ensure the optimal functioning of not only our body, but again whenever we are purchasing purchasing the food from the markets, so we have to be very careful about how to take as much as natural herbal things, and how to avoid these chemical things and the fast foods, and how to avoid the extra sugar, extra fat, etc., all these things. So, we have to be very vigilant about this nutritional value of the products we take, the products we take, we eat, we drink, and how to enhance our immune system. That is most important for all of us. Now, I am concluding this here right now. Next for next class onwards, we will discuss it further. Thank you.